The Health Insurance Amendment Bill 2024 could have several impacts on the ordinary people. It's the ordinary people we must try and protect here. And I have to declare that I've been in our hospital a lot lately, and I've both public and private, so I'm lucky to have the private. But as Deputy Bernardo says, the inflationary costs and the increases are just astronomical. Depending on how the new rules are implemented, people might see changes in their health insurance premiums. If the system becomes more efficient, premiums could stabilise or even decrease. We'll wait for that one. However, if there are implementation issues, premiums might increase significantly. And that's kind of a belt and braces here. We can't lose. The access to care, the bill aims to ensure that high cost levels are claims are adequately covered, which could improve access to necessary medical care and for those with serious health conditions. However, the focus on high-cost claims leads to neglect of other areas. Some people might find it harder to get coverage for alternative or routine care. And I just come up from the TIP2 and the Irish Cancer Nurses, and I salute the cancer nurses. I salute the volunteer drivers for the work they do. But it's shocking, Minister, you talk about all the figures here on recruitment. They tell me that there's an alarming lack of people to administer the scans and everything else in CUH and all over the country. No people coming in. And if you look with your permission, Councillor, it's very, very small print here. I have to go with my eyes, but I got a letter from a dentist this morning, my own dentist actually, and he said I could name him here. And it's Dave O'Connell, Daniel O'Connell, Townhouse, Key Clonmel, next to the man. But he's just pleading with me and pleading with you, and you've had this thousands of times, to do something regarding the subscriptions that they get, because he's one of the few that are left. And the costs are the first item of first visit, he gets €67 under the payment scheme. The second item of repair, they call it, for the dentures or dental necessities, €88. And the third claim is 109.6. This is not covering his costs. As we know, people, young or old, can't get access to dentists. Old people is very important, but it's vitally important for young people under the public system. They can't get it. And this bill here talking about access to health services, under this bill, and ensuring that there is for public patients. The public situation regarding the dentists, and you know this, the doctors, GPs had some kind of a renewal of the contract some time ago, and there was clamouring it for years. But the dentist thing hasn't been dealt with for decades. And they're leaving it like as fast as they can. Daniel is, like myself now, in mature years, and indeed doing an excellent service, but he's a wonderful, kind gentleman, doesn't refuse anybody, but they can't operate. No business can take on if you can't cover your costs. And I have an invoice here as well from him that, he got from an invoice from our suppliers. He just... The costs to him are far more than he's able to what he's getting from the government. So that, in any of us in business, I'm a business myself. Anybody, if you're less coming in for your person who's paying you, if you have less coming in than what your outlay is, you're not going to stay in business long. And he's not a greedy businessman. He's a wonderful, wonderful dentist, and he's staffed down team, and he lost one of his best receptionists quite suddenly recently. But please, will you do something for the dentist in your final time in office here? You know yourself, it's been brought to you by the association, it's been brought to your attention numerous times. So that needs to be supported as well, because there's not much cover under the VHI or under private schemes for that. So the public scheme needs to be supported also.
Thank you very much, Ken Corla, and can I thank deputies for their support of the bill. It is greatly appreciated, and I look forward to going to committee stage. Now, what I'm going to do with the time I have is address some of the other issues that colleagues raised. And whether I should or not, I'm going to start with the contribution from Deputy Boyd Barrett, because I listened to probably 5 minutes of misinformation during Leader's Question, which Deputy Boyd Barrett brought in. And I do now have a chance to respond, and I'm going to use that because Deputy Boyd Barrett, Cian Corla, stated very clearly that no progress is being made. He sets himself up as the champion of our healthcare workers, and he says there is no progress being made towards universal healthcare or Sláinte care. So our healthcare workers have halved the time people wait for an outpatient appointment. Deputy Boyd Barrett says that's irrelevant. They have revolutionised women's healthcare. Deputy Boyd Barrett says that's irrelevant. They've brought in IVF, free contraception. They'll be about to bring in free HRT. They brought in specialist services in menopause and endometriosis. Deputy Boyd Barrett says that's not progress. That's not relevant to anybody. They have invested in cancer services. Cancer survivorship rates are getting better and better and better in our public hospitals. Deputy Boyd Barrett said that's not relevant. It's not important. That's not progress. We have massive new community-based services in and around his constituency, mine, and everywhere else. Deputy Boyd Barrett says that's not relevant. We're not making any progress. The healthcare workers aren't making any progress. We have had a massive reduction in costs for patients, but apparently that's not progress and it's not relevant. Apparently free IVF, free contraception, 500,000 more GP cards, apparently these things are not relevant. They are relevant. And I want to acknowledge Deputy Cullinan, Deputy Shortall, Deputy Berry and others who, at least whilst rightly holding this government to account, to their credit, do acknowledge that our healthcare workers are making things better for patients. Is it better across the board? It is not. It is not. But let me tell you, the waiting times in this country, our healthcare workers have brought the waiting times down from over 13 months to 7 months, and we are going towards the agreed Sláinte care targets that no one waits more than 10 to 12 weeks. But apparently that's irrelevant. All of the progress that our healthcare workers are making, apparently according to Deputy Boyd Barrett, it doesn't matter. Well, it does matter, and we are making progress. And I want to fully acknowledge the point that was put to me by several colleagues saying, yes, progress is made, and they asked me, but will I accept that we are only some of the way there? 100% I will accept that. I think we're about half the way there. I think we're about 4 years into what is an 8-year turnaround to get to where we all want to get to, which is universal healthcare. It is the single-tier public system envisaged under Sláinte care, where care is affordable, care is timely, care is high quality, and the new services exist. And contrary to some of the misinformation that we hear in this chamber and elsewhere, contrary to that, I want to acknowledge that the healthcare workers in this country, the doctors, the nurses, the health and social care professionals, the Department of Health officials, the people working around this country, our GPs, our pharmacists, they are working night and day to make things better, and they are succeeding. Now that doesn't suit everybody. There are some people in this chamber who want the public to believe that we live in a failed state, that everything in healthcare is terrible. Everything in healthcare is not terrible. Things are getting better every single year. They're getting better every single month. Are there parts of our healthcare service which absolutely do not work for patients? Yes, there are. Of course they are. But you know, just this week, after years of work, we were able to announce really important progress on children's spinal. We were able to announce that this year the number of children waiting more than 4 months will fall from 86 to 20. It's still 20 too many, I fully accept that, but 86 to 20 in 1 year, and all 20 of them in consultation with their surgeons will be offered care in the United States. And I appreciate the facts don't suit some members of this House. I appreciate the facts don't suit the failed state narrative that our doctors, our nurses are achieving nothing on behalf of patients, but they are. I work with them every day, every week, every month. I've worked with them for 4.5 years. They delivered one of the best results on COVID anywhere in the world in terms of excess mortality, right? And the improvements that I'm talking about have been achieved by our healthcare professionals, and I want to acknowledge that. We spend a lot of time talking about hospital-based care, quite rightly. But look what has happened as well in community-based care, again, as called for under Sláinte care. In my own constituency, we don't have a big hospital. We don't have a Model 3 or a Model 4 hospital. But just in my time, I've opened 4 primary care centres in Wicklow, in Bray, Arklow, Rathdrum, Baltinglass. Planning permission has gone in Greystones, and there's going to be an expansion in Wicklow Town. That's just in Wicklow. We've given a huge amount of money in terms of daycare centres, Meals on Wheels. We're expanding the community nursing centres. We've allocated €5.5 million to the cancer support groups all over the country. Again, just in my constituency. It's Purple House in Bray, Greystones, Wicklow Town, Arklow, Rathdrum, Roundwood, West Wicklow. And that's just some of the community-based improvements in healthcare in a county that doesn't have a major hospital. And so, again, Corla, I'll finish on that, and I apologise if I'm a little agitated. But I come in here again and again and again, and I hear certain deputies in this House saying nothing is improving. The deputies over here talked about cataracts. Here's what's happening on cataracts. Until this government came in, the waiting time for cataracts for adult, where we stand now in Dublin, was 5 to 6 years. It's now less than 12 months and falling to the agreed Sláinte care targets. Children who were referred in for specialist care, Now, I appreciate you don't like the truth. I appreciate that. I appreciate the truth doesn't suit you, right? Fully appreciate the truth doesn't suit you.
A little bit of manners, please. Let the Minister reply.
Democracy may not suit you, the truth may not suit you, but our healthcare workers have reduced the waiting time, for children in the Dublin area and other parts from 2 to 3 years to 6 weeks. Now, what about in your own area? You're aware of the really important investment we're putting into Ballincollig. You're aware we've taken the cataract surgery out of CUH, we've put it into the Royal Infirmary and Ballincollig. And if you look at the figures, what you will find, I fully accept it's not fixed, I fully accept we're not there yet, but what you will find, Deputy...
Why did you close down Tralee? I asked you that question.
The democratic debate may not suit you, I fully appreciate that.
Why did you close down Tralee and
appreciate the parliamentary debate.
Why did you close it down?
And I appreciate that the record investment into healthcare in Kerry and healthcare in Cork doesn't suit your election campaigns. But it is nonetheless true. And no matter how much you shout at government, no matter how much you come in here with false information, it is a fact. It is a fact.
Please, Deputy.
It is.
No, please. You're making this into another Hall's Pictorial Weekly. Would you please? Sure, he's not here to answer that particular question. Will you resume your seat, please? Will you let? It was, but this isn't. This is not a comedy show. It is not a comedy show. Would you resume your seat? Resume your seat, Deputy. Please. Please. Now, can we... Deputy Collins, would you please let the Minister respond?
It may not suit you that there is record investment going in. And by the way, not for a moment am I suggesting that everything is fixed. Deputy Cullinan, Deputy Shortall and others have quite rightly pointed out that we have several years to go. But it is undeniable that our healthcare workers, who have been hired in record numbers, are turning this ship around. In my constituency, in your constituency, they are doing that. They are turning it around. They are reducing waiting times. They are rolling out new services. And Deputy, you can shout as much as you want, but it will not take from the improvements that healthcare workers are making in your constituency and in mine. Gurmagad Count Corla.
Thank you. Now, no, you don't need to clarify anything.
I do.
What?
We're talking about our real experience in Cork and Kerry, Tipperary, Israel.
Sorry, Deputy, resume your seat.
I mean, I'm not being angry. I'm just saying it's unfair to listen to all about Dublin.
Please.
The rest of Ireland deserves fair play.
Please.